All right, let's get started here. Thank you for those who are in the waiting room. Really appreciate everyone joining this call. My name is Peter Knudsen. I'm the Director of Communications at the American Association for Justice. Thanks for joining us. We're here to discuss today the terrible impact that blanket immunity would have on nursing home residents and nursing home staff. We have three individuals on the call here who will be speaking in a moment, who have knowledge and experience that I think will be illuminating on just how much is at stake in this debate. As many of you know, Senate Majority Leader Mitch McConnell is demanding, saying it's his red line, that any relief package coming from Congress to help those individuals who have been harmed by the pandemic, that any relief must have a provision giving a blanket liability immunity to corporations, corporations like those that operate nursing homes. Long-term care advocates, civil justice groups, and others are rejecting the inclusion of this really dangerous provision. It will simply further reduce nursing home patient and employee safety. And honestly, it's the opposite of what Congress should be doing right now in this unbelievable challenge that we're facing as a nation. But Senator McConnell is seeking to remove really one of the only measures of accountability that remains to encourage businesses and corporations to act reasonably. And honestly, he tries this every time that there is a national crisis, getting this kind of immunity pushed through. But if he gets his way this time, it will make it nearly impossible to get ahead of this crisis, ahead of the spread of this virus, this pandemic. And honestly, more lives will be lost, including in nursing homes. Really, this legislation amounts to a whole-scale revision of most states' medical malpractice and nursing home care laws, and would prevent claims from being filed regarding COVID-19 and more. Since bringing a lawsuit is one of the only tools that families and residents have to demand safety, a blanket immunity like this would just worsen the already really bad COVID situation in nursing homes, whereas we all know and we've all been seeing so many lives have been lost already during these last few months. I should add, the American people, we know, are overwhelmingly opposed to this McConnell plan. There was a poll that came out yesterday from CNBC, a polling firm called Change Research through CNBC. It said that they surveyed likely voters in 6 swing states, and 58% oppose granting this kind of immunity that we're talking about today. Only 32 think that giving corporations this blanket immunity is a good idea. So 58% of people in swing states understand that this is, again, just a terrible idea and the opposite of what Congress should be doing. Okay, let's just get right off to our speakers. Speaking first, we have Toby Milrod, the newly elected president of the American Association for Justice. He's also a practicing attorney in Philadelphia, Pennsylvania. Toby actually suffered personal loss himself during this crisis, so he's going to talk about that as well as his perspective from AAJ. Toby?
Thank you, Peter, and good morning to everyone. Proving that he is tone deaf to the coronavirus fears and insecurity of the American people, Mitch McConnell has introduced a corporate immunity bill that is extreme and reckless to health and safety, just to line the pockets of his corporate friends. Included within the provisions of the bill is one of the more heartless proposals. Nursing home operators, who have proven to be woefully inadequate in this pandemic to protect our nation's seniors, and are killing them at an alarming rate, those nursing homes would now enjoy blanket immunity from accountability for negligent acts. This bill sounds the alarm that it is time for Senator McConnell to end the charade. End the charade that he believes the American people are as important as his corporate friends. End the charade that the American people are not entitled to the basic right of accountability when they are wronged by negligent corporate actors. and end the charade that Mitch McConnell cares about our seniors when he is willing to make them an expendable statistic, just so nursing home operators can freely collect profits without the accountability of keeping our parents and grandparents safe from the preventable spread of coronavirus that is ravaging our country's nursing homes. If I sound angry about this gross political overreach at the expense of our nation's seniors, I am. And that's because this bill and the rights it eliminates are personal to me. On April 22nd, I lost my mother, Sylvia Milrod, to COVID-19. She died of coronavirus in a nursing home. She died alone, in her bed, in a nursing home that was woefully ill-equipped and inadequate to protect her. She died without any of her 7 children, or 16 grandchildren, or 2 great-grandchildren by her side, holding her hand. How terrified and sad she must have been. At 82 years old, she was ripped away from us. 4 weeks earlier, she was in the activity room pursuing her passion of art, drawing away, and keeping staff and friends at the nursing home entertained and engaged with her humorous wit. When coronavirus showed up in the Philadelphia region in March, the nursing home shut its doors, barring family and friends from even visiting. The opportunity for outside contact and risk of COVID was seemingly cut off. So how is it, you might ask, that she got her terminal exposure to COVID-19? Sadly, on a chance encounter I had with her 9 days before her death, I saw a reason how this could have happened. After I ended a FaceTime video conversation I had with my mom, a nursing home attendant tending to her accidentally rang me back as she was cleaning the iPad Surface. This time, though, the camera was facing the nursing home staffer. She had on no PPE. She had a small, flimsy mask just covering her mouth and not her nose. I knew when we hung up, my mom was helpless. The nursing home obviously cared for her in such a way that treated her as an unavoidable casualty to a spreading disease. But it didn't have to be that way. It was avoidable, and the unacceptable and unreasonable failures to protect my mom entitles me, should I choose, to seek accountability from that nursing home. That's as basic an American right as there is. And any American who embraces their 7th Amendment constitutional right to a civil jury would say to me, well, yes, at least you have the right, if you want it, to hold the nursing home accountable. With Mitch McConnell's blanket immunity bill, the choice to hold the nursing home accountable is gone, and the rights are extinguished. My mom deserved better. One of the things that angers me the most is how Mitch McConnell is making ordinary Americans like my mom and my family pawns in his political game. America is tired of vendetta politics. America is tired of abuses of power to settle personal scores. And that's what this bill is. Mitch McConnell is exploiting a national crisis amid a pandemic that threatens the very way we live to settle a score and achieve his legislative bucket list of scoring broad nationwide corporate immunity. This has nothing to do with policy or principle. Indeed, Senator McConnell's bill is an affront to conservative Republican ideals. It tramples on states' rights, wiping out states' laws on the books that already provide protections to businesses and consumers alike. It ignores the free market. In fact, it stifles it. What American will want to put a parent or grandparent in a nursing home knowing they have no accountability? Safer nursing homes with accountability in place means nursing homes can be full again, caring for our seniors. What American will want to return to offices or frequent businesses knowing these places will have no consequences for acting unreasonably toward safety? So our nation's businesses will suffer needlessly because of Mitch McConnell. And a free market and our Constitution, under conservative principles, has held for almost 233 years that where people act unreasonably, the marketplace resolves that dispute at a civil jury trial. This bill is a perversion of the Constitution, an abuse of legislative authority. With it, Senator McConnell is advancing extreme provisions like all cases will be forced into federal courts and away from states. The standards for what has to be alleged in a legal action will now have requirements that far exceed what the Supreme Court of the United States says. Legal standards unseen in the law to date, where all a corporation has to do is to try hard to avoid liability. It tramples on the 10th Amendment, giving states the right to govern how unreasonable conduct should be addressed under state law. Senator McConnell, this bill tells Americans that you are undisciplined and that you are unnecessarily walking us right into a risk and then recklessly stripping us of our rights to address being put at risk unreasonably. That is not the will of the people that you are bound to represent. We call on you to save yourself from defeat of this bill and focus on caring about our seniors, caring about our parents and grandparents, caring about people, not corporations. Thank you.
Thank you so much for that, Toby. Just real quick before we get to our next speaker, I should have mentioned at the top, when we're done with our next two speakers, if you have a question that you would like to ask of any of them, if you could please indicate so in the chat function at the bottom of your screen. We'll be taking questions at the conclusion of the next two speakers. Please go ahead now if you feel so inclined to indicate that you have a question in the chat function between now and the end of our two speakers. Next up, I'd like to introduce Sam Brooks. He's a program manager at Consumer Voice. Consumer Voice is the leading national voice representing consumers related to issues of long-term care. Sam has expertise on nursing homes and nursing home regulations, and he has years of experience advocating on behalf of residents. Sam?
Thank you, Peter, and thank you, Toby, for those powerful words, and I'm tremendously sorry for your loss. 59,000 residents of long-term care facilities have died from COVID since January 2020. That's roughly 40% of the total deaths from COVID in the United States. Countless other residents have suffered harm due to inadequate staffing and inadequate and poor quality of care. The full extent of harm to residents is just not known yet. Facilities are on lockdown. Hundreds of thousands of families are worried about their loved ones and what is happening to them. And what is becoming clear as time passes, and Toby alluded to this, is that this could have been prevented. The crisis in nursing home could have been prevented. Increasingly, we're finding that homes with the biggest outbreaks of COVID-19 and the highest amount of resident deaths were also facilities that have long histories of poor quality of care and understaffing. In May, the General Accountability Office released a report showing that 82% of all nursing homes in the United States had an infection control violation in the years prior to COVID, with half of them having continued in repeated problems. CMS itself, the Center for Medicare and Medicaid Services, has also said that there's been a correlation between poorly performing homes and outbreaks. And now we're starting to see studies that directly link higher numbers of COVID cases in facilities with understaffing and poor quality of care. This could have been prevented. And Toby talked about lawsuits and talked about standards. And I think what's important is that this judicial liability for poor care isn't just about lawsuits. Judicial liability has always served as incentive for actors to behave reasonably. And this is whether you're driving a car on the road or if you're providing care in a nursing home. Because what actual liability is, it's saying that facilities must act reasonably, and they can't act unreasonably, either by not following a law or regulation or adhering to accepted standards of care. By taking away the penalty for that, which is judicial recourse, you're telling facilities they can act unreasonably. They're telling that it's not necessary to adhere to those standards of care. And this is an absolute realignment of what is considered acceptable care in nursing homes. It absolutely strips residents of protections of laws and regulations and tells them at the time during the middle of a pandemic that they are not entitled to care that is provided in a reasonable manner. And something that was alluded to is that, Never has judicial recourse been more important than it is right now, right this minute. It functions as a silent oversight, and it always has. But it's one of the last remaining oversights in facilities right now. Due to lockdown, residents' best advocates, their families, their loved ones, have been unable to see them for months, over 4 months. Resident advocates such as long-term care ombudsman and adult protective services are barred from entering facilities. And licensing and survey agencies are very limited in what they are doing in facilities. They are not investigating complaints and they aren't conducting annual surveys. This means residents have been left to themselves. Really, the last remaining protection for residents is judicial recourse, is the idea that if you harm me, facility, could take you to court. But the Safe to Work Act removes that. It removes the last remaining protection from residents. It's important to note that nursing homes already have sufficient protections in lawsuits. Since the beginning of the pandemic, the industry has tried to capitalize on the suffering of residents to push immunity. It cited shortages of staff, shortages of PPE and other supplies. However, facilities that took reasonable steps and acted in good faith to obtain PPE and to obtain necessary supplies, but were unable to because of shortages, will already be protected in court. Each state in this country protects and shields folks from who act reasonably but are prevented from obtaining necessary supplies. This law is not about protecting nursing homes that were unable to obtain necessary supplies because of COVID. It's about protecting bad actors. Lastly, and I think this is important, is that the Safe to Work Act disingenuously invokes the incredible sacrifice of nursing home workers during the pandemic to justify granting immunity to facilities. It's absolutely false. Nursing home workers are rarely, if ever, sued. They're just not, they're underpaid and they don't have anything to be liable for poor care. It's facilities that are sued. In fact, immunity makes workers less safe. When facilities relax compliance with standards and laws, conditions deteriorate and workers are more likely to become infected with COVID and more likely to be harmed. That's why organizations that represent nursing home workers, like SEIU, oppose immunity. Hundreds of nursing home workers have died from COVID. Countless others have become infected. Yet the Safe to Work Act cynically and knowingly capitalizes on their deaths and their sacrifices in order to protect nursing home bad actors. Closing, it's quite remarkable that in the midst of a global pandemic, a pandemic that's affecting nursing home residents the most severely, the Senate has decided to propose, Mitch McConnell has decided to propose to remove the last remaining protection for residents. The Safe to Work Act will inevitably lead to more unnecessary harm and death in nursing homes. We urge Congress to reject it and to focus on passing laws that actually protect nursing home residents, but not harm them. Residents are our parents, our grandparents, our friends, and our neighbors, and they deserve much better. Jamie Worthy-Smith, who is on the call with us today, sister Kim McCoy-Warford died from COVID in Brighton Medical Center in Beaver County, Pennsylvania. We're here today to do a fun experience. The day before Kim died, the Pennsylvania Department of Health inspected Brighton and found egregious infection control violations, including no social distancing, failure to sanitize equipment, lack of hand soap, and soiled linens left out in the open. Notably, the Department of Health found all of these violations to be minimal harm, the lowest level of violation, which is inexcusable and inexplicable. However, in the next 2 weeks, residents began dying precipitously from COVID-19 in Brighton Medical Center. Because of attention from the press, the Department of Health went out again in the first week of May, and they found the same violations, but this time found immediate jeopardy, the highest level of violation. To date, at least 85 residents have died in Brighton Nursing Home from COVID. So I wanted to have Jamie share her story of her sister. Jamie?
Good morning. Thank you, Sam. Thank you, Peter. I am Jamie, as they have introduced me, and I would like to put a picture, a face with the story. This is my sister, Kim McCoy Warford. She entered Brighton Wellness at the age of 57 years old. My big sister was vibrant. She was free-spirited. She was funny. She was a loving, beautiful woman who was the mother of my nephew, her only child. She had one granddaughter. She was my mother's oldest daughter. And her granddaughter mirrors her beauty. Kim loved her family. She loved music. She loved to dance like nobody was watching her. Unfortunately, early onset dementia came and robbed Kim of some of these memories that we continue to hold on to. We entered her into Brighton at the age of 57 years old. And unfortunately, Brighton Wellness and COVID-19 ended her life. On March 23rd, I received a call from Brighton stating that Kim had a fever and that she would be given a bedside x-ray at the facility, that I should have no worries. This same facility was locked down, as Toby said, at the beginning of March here in Pittsburgh. The next day, I called to check on my sister and was told that she was being her normal self and that the new procedure at that time was to take her temperature every 2 hours. On Thursday, March 26th, during the night, Kim was rushed to a nearby hospital with a fever and wheezing. I was then told it was pneumonia. A COVID-19 test was supposedly administered, and she went right back to the same facility with prescriptions for Kelflex, azithromycin, and Tylenol. On Friday, March 27th, Kim remained ill and was taken back once again to Heritage Valley Beaver. However, this time she was admitted. Please keep in mind that dementia also robbed my sister of her ability to communicate and her ability to walk. My sister was nonverbal, frightened, and alone. When Kim was taken back to the hospital and admitted, we were informed by her PCP that Kim had been in the room with the first patient diagnosed with COVID at Brighton. The next day, we received the dreaded news that Kim had tested positive for COVID. Never once had the facility informed us that Kim had been exposed. It was explained to me by the hospital that Kim would be placed on hydrochloroquine, the preferred drug, should I say, at the hospital, forgive me. I never gave verbal consent. I never signed any authorization for her to receive the drug. By the time we were informed, Kim had been placed on the drug. Their plan of treatment for Kim was to be on this drug for 5 days, and she would be returned right back to the same facility, supposedly on the new COVID unit that was established for patients that were returning back to the facility. I expressed concerns, serious concerns, about Kim being returned to the nursing home. However, because she was not on a ventilator, Kim was taken back and there was nowhere else for her to go. What I've come to realize is there was no new COVID unit. Kim was taken back to Fort East, where she had been for the past 7 years. I called repeatedly, speaking to the aides and the unit nursing director, and was told that Kim was improving every single day. On March 9th, Kim's 64th birthday, I called and was told that Kim had turned the corner and she was sitting out in the open at the nursing station. Found that kind of odd because watching news reports, it was told that to the media that everybody at the facility had COVID, including all the workers. That was the report coming out of the facility. I asked that Kim be returned back to her room, that I had concerns for her, and that I needed her to be kept out of harm's way. On April the 14th, I was told that she was being classified as resolved. She had been asymptomatic for 5 days, and that she had completed her course of medication. Unfortunately, on Thursday, April the 16th, I received a phone call in the morning from the nursing home informing me that my sister had been found unresponsive and that they couldn't wake her up. A large amount of fluids and mucus was found in Kim's mouth, and she could not be resuscitated. I received a call several hours after that asking me, was my sister a do not resuscitate, which she was. Therefore, for the next 48 hours, my family and myself was forced to watch my sister die on an iPhone that was supplied by the nurses and the aides, not by the administration. For that, we are grateful, because my sister would have died without hearing our voices. My sister went on to suffer, dying alone by herself for 48 hours. Kim passed away of COVID on April the 18th. Brighton could have controlled this disease with better execution and a solid continuity plan, but they failed. They failed tremendously. The results of their negligence and poor infection control cost my sister her life. My nephew, Michael, never got to hold his mother's hand as she departed this world. Her granddaughter will never know her. My family, who we are accustomed to grand celebrations when we enter this world and when we leave, were robbed of the opportunity to celebrate the life that God gave Kim. I still have not received a call. I still have not received a card from the facility offering their condolences. My sister was only a part of their family for 7 years. I oppose immunity because I do not want to see this happen to any other residents and their families. I do not want any other residents to suffer the way that I am suffering, the way that my family has suffered and is still suffering. But most importantly, I do not want to see any other residents suffer the way that we watched our sisters suffer for 48 hours. I do not want any other family to experience the horror of having to watch a family member die on a cell phone. And by granting the nursing homes immunity during this pandemic, the government will be ensuring that other residents will surely suffer and they will die. Thank you all for your time.
Thank you, Jamie, for sharing that with all of us. Thank you to all of our speakers, but especially Jamie and Toby for sharing your, helping us all understand just exactly what immunity, what's at stake here. Thank you, Jamie.
You're welcome.
That's it for our planned speakers. For anyone who's on the call who would have a question, we do have the chat function, but it would also be all right if you want to just do the virtual hand raising, and we'll unmute you for any question that you want to ask of anyone here on the call related to immunity and nursing homes. So we'll wait a few seconds here. If anyone on the call does want to ask anything, please indicate in this group chat at the bottom of your screen or with the hand raising. Or I suppose you could just turn your camera on and wave, and we'll unmute you. We can wait just a few seconds here and see if there are any questions for anyone, but otherwise, I think that the scope of what the three of you covered today, I think gives us all a lot to think about. Direct, could you, maybe we could just unmute
Yes.
our question here.
Hi, this is Ricardo Alonso Zaldivar from AP. Can you hear me?
Yes.
Okay, good. Yeah, I just have a simple question. If you could please describe how the mechanism in the bill would work. In other words, as if you were, providing a summary of the legislation.
You know, I think for that one, thank you for the question. I think since we actually have someone here, wasn't one of our speakers, but we had her on to speak specifically to questions about the legislation itself. If I could please introduce Sarah Rooney, who you'll see on your screen there. She is a senior director in the Public Affairs Department at the American Association for Justice. Sarah, if you could help just give a kind of an overview of how the bill works.
Sure. As a general overview, a typical claim in this space would proceed in state court. This moves everything to federal court. It raises the standard. Essentially, it gives immunity to apply if you attempt to comply with any standard unless you're grossly negligent. And the definition of grossly negligent is significantly higher than gross negligence is typically defined under any state law. It requires that you have some sort of conscious or sentient disregard, which makes it essentially impossible to prove. So, that is the big picture, how this is intended to work. In addition to that, a big thing in terms of nursing homes is that it, in most cases, does not provide for nursing home residents to get non-economic damages. And so that would be pain and suffering or anything like that. It only provides for economic damages, which would be, your lost wages or medical costs. So in this case, even if you were able to meet the new hurdles of gross negligence and bringing this case in federal court, that kind of thing, there would be, in the case of a nursing home resident who is not employed, and in this case, likely to be deceased, there would be very little to no damages available to you, making it very unlikely that you would go forward to pursue the case. Is that?
Yeah, and as a follow-up, Sam Brooks said that there are already all sorts of hurdles in state court in order to bring suit against a nursing home. And I asked him to sort of, please summarize that.
Sure. There's 50 different states.
Right.
Obviously, you know that. And there's different laws in every state. For instance, I was speaking to a family member in Alabama, and they already have such significant barriers to lawsuits, including the level of proof, what evidence is submitted, who can testify, and the amount of damages that are available, that it really inhibits the majority of nursing home cases. I suspect that maybe one out of 10 cases are taken currently under various state laws, and this will bring it almost down to zero. And when I was speaking earlier about the barriers, what I meant was that not just in nursing homes, but in every area of liability, if the home is following guidance and making reasonable taking reasonable steps, but somehow is inhibited by COVID shortages or some other thing outside of its control, they'll be shielded from liability. And that's true in every state. I certainly can't, speak to all the different laws in every state, but these cases are hard to make anyway. The industry has done well in the states already to limit when they're liable, and this would just pretty much stop likely all suits. And one thing I just wanted to talk about too is that this is for 5 years, right? This is from 2019 to 2024. And it's not just about harm from COVID. It's about all negligence. If the facility can make if the facility can show somehow that its response was to providing care was affected by COVID, and they were relying on some sort of guidance, be it local, state, or federal. And local, I don't know who that is. It could be the sheriff, who knows? If you can connect your reliance on that, it's gonna bar all claims of negligence. And that means that facilities that had no cases of COVID, zero, who tie their negligent care into harming residents, they tie that into their response, will be barred. Those residents will be barred. So this is draconian. This isn't just about, this excuses all care. Thanks.
Okay, thank you for taking my questions.
Thank you very much. I see we have a question from Michelle. Michelle, I see. Thank you for putting it in the chat. But if you wouldn't mind just verbalizing it on the call here, and we can get some answers.
No problem. Considering the arbitration agreements that many residents have to sign prior to entering nursing homes, I'm wondering if you could explain how the bill provisions would interact with those agreements and how those arbitration agreements kind of play into this situation.
Sure. I think that also sort of goes to what Sam was talking about, is this is already a huge hurdle that nursing home residents have to go through if they want some accountability in this space. And this immunity just layers on top of this for nursing home residents. And so this is essentially, you have this huge impediment, and this just adds another huge limitation on if anybody can actually get their claim to be evaluated by, court and see the light of day, get the discovery to see what was actually happening in the facility.
Okay, thank you.
All right. Thank you for the questions, and thank you to all of our speakers. Sam, Toby, thank you for sharing your story, and Jamie, thank you. Thank you for coming on here and talking about your experience and what this means to you. I think we're all going to carry that with us going forward. Of course, I'm happy. Anybody else who didn't ask a question, please reach out to the AHA Communications Department. Myself, peter.knudsen@justice.org if there's any follow-up, or if you want a recording of this conversation or anything like that, peter.knudsen@justice.org. Happy to talk with people going forward. Thanks everybody for joining.
Thank you.
Thank you.